All right, we're gonna wait for everyone to join in and then we'll go ahead and get started. All right, so in the interest of time, I think I'm going to go ahead and begin the introductions. I'm Jessie Burke, Associate Dean for Education and Faculty in the Department of Behavioral and Community Health Sciences. And I want to welcome you back to the Pitt Public Health Conversations about COVID seminar series. A reminder that more information about the series and other COVID-19 Pitt Public Health related efforts is available on our school website. You'll also find copies of or recordings from previous conversations as well as answers to the questions that we didn't get to during the actual conversation. So a little bit about format. Following my introductions, the speakers will discuss a topic, they'll talk to each other a little bit, and then we'll open it up for questions from the audience. When we get to that portion, please make sure to use the Q&A function to ask your questions, and I'll help to moderate the discussion. You can go ahead and post those as they come up, and I will moderate them once we get to that portion of the session. So it's now my pleasure to introduce you to our guest speakers who will discuss the health department response to COVID-19, both at the local and state levels. So Dr. Catherine Haggerty is an associate professor in the Department of Epidemiology. Her research is focused on infectious causes of infertility and adverse pregnancy outcomes. She's currently serving as a member of the COVID-19 response team for the Allegheny County Health Department. During the peak of the cases, the COVID-19 cases here in Allegheny County, Dr. Haggerty served as a member of the case investigation team, which is collecting epidemiologic and clinical data on cases and playing a large role in helping to flatten the curve, and in part through initial identification of close contacts. She also tracked and continues to track and rapidly review the changing guidelines provided by the CDC, the Pennsylvania Department of Health, and the Council of State and Territorial Epidemiologists to provide and develop local protocols. So we're really excited that she's here today with us. Joining Dr. Haggerty is Dr. Wendy Braun, who is the Director of the Center for Public Health Practice, Associate Dean for Practice, and Professor in the Department of Health Policy and Management. Prior to coming to Pitt Public Health, Dr. Braun served as the Wyoming State Health Officer and Public Health Division Administrator for the Wyoming Department of Health. During her tenure in Wyoming, she led the state's public health emergency preparedness, response, and recovery efforts. Prior to moving west, Dr. Braun was employed by the U.S. Department of Health and Human Services, serving in the Office of the Assistant Secretary for Health, Office of Disease Prevention and Health Promotion, and subsequently in the Health Resources and Services Administration, the Bureau of Health Professions. So I'm really excited to have both of our speakers here with us today. I'll now turn it over to Dr. Haggerty, who will start the conversation with the discussion of the approaches, impacts, and challenges of containment and mitigation efforts at the county level. And then Dr. Braun will continue the conversation by comparing and contrasting the response at the state level. Dr. Haggerty. All right.
A moment to share my screen here.
Sure.
Great. Is it showing?
It is. Thank you.
Wonderful. Okay. And thank you, Jessie, for the introduction. I'm really delighted to be participating in this COVID-19 webinar series and discussing the health department response with my colleague, Dr. Braun, as well as all the webinar participants today. So thank you all for joining on today. And certainly the health department response to a pandemic occurs at multiple levels and really requires coordination and collaboration between county, states, and national levels, all being essential components of the response. And so, as Jesse introduced, I'll be starting with the discussion today by introducing the efforts at the county level, at least some of those efforts at the county level. And so I thought that it would be great to start just with an overview of the timeline of the outbreak here in Allegheny County. And what I'm showing here is the epidemic curve, or epi curve, that shows the distribution of cases by date of onset. And I'm starting with the initial outbreak here in the county. And this curve is useful. It's not only gives us some important regional snapshot of the course of the epidemic, but also highlights important components of the public health response. And I'm going to overlay those on this graph today. And so, as I'm sure everyone is aware, the outbreak began here in Allegheny County in the middle of March, roughly, with the first 2 cases identified on March 11th. And a very short period of time later, on March 16th, there was a hint at what looked like was going to be an exponential increase in the cases in our county. There was a sudden jump up. And at that time, the Allegheny County Health Department rapidly instituted and called for voluntary business closures. And that was followed a couple days later by the governor's closure of non-life sustaining businesses throughout the state. So these all occurred very early in the timeline, followed by on April 1st, the stay-at-home order being announced. And you can see, if we look at the curve here, again, this is really at the peak of the cases in our county. They were anywhere between 40 to 50, even higher on some days, cases per day. But we can see that after these initial measures went into place, we do see a decline in the cases. And I've overlaid here then the transitions to the yellow and green as well. And so we've seen, I think, certainly a flattening of this curve, although we're kind of holding steady and sort of just jumping up and down in recent weeks, anywhere between sort of 5 to 25 cases per day, kind of just some little waves of cases in this range. And overall, over the entire outbreak period in this region, we've seen over 2,000 cases, and at this point, over 170 deaths. And so certainly there's been a big impact in our region, smaller than, we're fortunate, I suppose, that this is smaller than impacts in other regions and even in other counties and areas within the state that have seen larger numbers of cases. And so I do think that we have seen some beneficial effects of these very early efforts to mitigate community spread. And so the intent of these mitigation efforts are to reduce community spread by optimizing and really calling for setting parameters that ensure physical distancing and prevent spread within the community. And I thought it would be interesting to pull some data that really looks at that community mobility and seeing what's happening within the community's response to these policies that were put into place. And these data that I have on this slide come from Google and a new initiative that Google has to share what they're calling Google Community Mobility Reports. And this particular report that I pulled comes from a recent 6-week period. You can pull these 6-week periods of data and look at changes at the aggregate of time spent by the population in Allegheny County in various sectors. And this data come from Google databases that are ordinarily used to track this kind of movement throughout the community, but they're being made available so that public health officials can use this to see the effects of policies and whether changes would be warranted. And so we see, not surprisingly, that there's been significant decreases in time spent in retail, grocery, transit, workplaces, and uptick in parks and residential spaces as well. And so these data, I downloaded the database. You can actually download the database, and data are available globally, and then within the United States, you can subset to state or county level. And so I subsetted to Allegheny County and tracked specifically from the time frame just before the first cases were identified up to the most recent data that was available at the time I downloaded this data. And I think some really interesting patterns emerge. So again, you can overlay here the voluntary business closure and the red and the yellow. And you can see that in sort of the week leading up to this voluntary business closure, and as the cases were starting to be diagnosed within the county, there was an uptick in the time spent in groceries and pharmacies, so almost a preparation for the storm, if you would. Followed by, not surprisingly, increased time spent in residential and parks, and decreases in time spent in all these other segments of the community. And interestingly, I think too, if you look sort of at this tail end in the yellow, we're seeing more time spent in parks, perhaps because of the improvement in weather in Allegheny County. But I think also, in all seriousness, of the transition to the yellow phase, and also the public health message is getting out that the virus transmits less easily in outdoor spaces. So interesting, I think, to look at these patterns, and it can give us a sense that really the policies are having their intended consequence of hopefully playing a role in that lowering of cases within the county, but also really having an effect on reducing community mixing and community spread. And so containment efforts, including intensive case investigation, isolation, quarantine, and testing, are also really key components that I wanted to highlight today of the health department response to any outbreak, including COVID-19. And so this includes the identification of cases in this picture. All of the individuals shown in red are the cases, and for every case, identifying their close contacts, and then trying to determine which of these are new cases, and which are also just close cases that need to be monitored and quarantined. And so I wanted to highlight the difference between isolation and quarantine, because this is a very these are very important efforts that have slight distinctions. And sometimes these are mixed in lay discussions. So isolation is used to separate sick persons, so in this case confirmed cases, and specifically to keep them in that isolation until they're symptom-free and can be released from isolation. So there's that are based not only on time, but also resolution of symptoms. Quarantine is used for the close contacts, and it's used to separate those persons and restrict the movement so that they can be monitored for a period of 14 days. And this is really important because this can help to reduce the potential for asymptomatic or pre-symptomatic spread. And so a little bit about the nuts and bolts of how contact tracing works. And this is done, I will be kind of giving an overview of this process that is used at the Allegheny County Health Department. Some counties do conduct their own contact tracing, particularly larger counties, whereas some tracing is done at the statewide level as well. But here at Allegheny County, I just wanted to highlight sort of this two-step process in contact tracing. And the first piece of that process is called a case investigation. And so a case investigator reaches out to cases for whom we've received laboratory confirmation of COVID, and collects detailed clinical and epidemiologic data, and also provides isolation guidance, and has this one-on-one human interaction to answer questions as well in isolation guidance, and provide other guidance on resources that could be available to support the person in isolation as well. And importantly at this time, very detailed identification of contacts is done. So the case investigator collects a list of all the close contacts from about the 48-hour period before symptom onset, and then turns this list over to the contact tracing team. And this team then picks up by reaching out to all of these close contacts, assesses them for symptoms, and then if they're symptomatic, provides them with guidance as a probable case, provides guidance on testing, and then also isolation guidance. And if they're asymptomatic, they would provide quarantine guidance as well. So in the case of COVID-19 or any pandemic, there are certainly challenges in the contact tracing process. So first, the sheer magnitude of contacts that need to be traced requires a large number of persons and of public health workers to achieve that goal. And some have described these needs as being an army. And so there's been a lot of press on building coronavirus corps, civilian corps, volunteer corps, paid corps. And in Allegheny County, a medical reserve corps, a volunteer corps is available to provide support for contact tracing efforts. There is also a building of contact tracing capacity within the southwestern Pennsylvania region in general that is occurring, so that we can build the capacity for volunteer and possibly other contact tracing positions within the region, so that we can readily respond to the expected spikes in COVID-19. And next, I'd like to highlight that contact tracing, case investigation, and contact tracing is perhaps not as easy as it sounds. There's a lot of challenges simply just to getting this process completed. And so certainly very good interpersonal interviewing skills, persistence are all incredibly important, organizational skills. But really, some of the key challenges that I wanted to highlight is that it can be very difficult to get in touch with cases and contacts at times. Individuals may not want to answer the phone if they think it's a telemarketer, they don't recognize the phone number of who's calling them, or if they do, they could be suspicious or be concerned about their privacy. So one needs to be able to kind of manage and handle all of these challenges as they come. Also, patients may be hospitalized, intubated. One may need to rely on a family member to complete an interview, and family members could be very distraught. So all of these things make this challenging job even more challenging. And so some creative and perhaps somewhat controversial solutions have been developed to address some of these concerns. A relatively new addition to the COVID-19 toolkit are contact tracing apps, and advocates argue that they will really aid with rapid identification and immediate notification of contacts as compared to old school contact tracing. So again, any delay in reaching individuals for that initial case investigation and contact tracing can add days to that piece of the timeline. So the argument is that contact tracing apps could make that more automated and quick, and can be done in an anonymous fashion as well. So basically the way that these apps work are that you need to have good uptake of the apps in the population, and then that assumes that when individuals are circulating throughout the community or going to a party or store, that enough individuals around them also have that app, and then their phones exchange sort of these temporary anonymously assigned IDs that creates a log of everyone that has been around others with phones. And then if a case is identified, it immediately sends out a notification to those contacts and shares the information that they were exposed to a case. And so certainly this is creative, and I think has the ability to augment the contact tracing process, but there are some potential concerns. Some concerns over privacy have been raised. Data are stored anonymously, but there's concerns about potential for linking to databases that could contain some personal identifiers or hacking. And some people just, if maybe not want to, suspicious of the apps, not want to use the apps, and again, with low uptake, they will not work. Also, I think that there's been some discussion that we really need more pilot data to know how, what the efficacy of these apps are. How well do they identify contact tracers as opposed to sort of old school contact tracing methods? So I think we really need some more data. I think it's definitely an innovative, interesting approach that could be used to supplement ongoing contact tracing efforts. And to make this all happen, Apple and Google collaborated and released some operating system updates just in May that allow for this COVID-19 contact tracing ability. And Apple and Google now have created this framework that allows other apps to be based upon this framework and then be used to do some contact tracing. And I just recently checked out, I have an iPhone and checked out the iOS update, and indeed it's in there, and wanted to include some pictures of what the screenshots look like. Interestingly, to get into this, the first place you need to go is into settings and privacy, and then health. And then you can toggle on this COVID-19 exposure log, and it explains sort of what I've explained here to you about how it works and how it collects this anonymous data. But importantly, then, you can't really do anything with this if you do not have the contact tracing app or a contact tracing app that's an approved contact tracing app downloaded on your phone. But if you do, then you can turn on all these features that make it work. And some states and countries around the world are developing voluntary apps. In the US, my quick survey shows that maybe about a half a dozen states have developed and are using or piloting apps at this time. And the uptake has not been extremely large yet, so I think it'll be interesting to see what happens with these tracing apps moving forward. And in the state of Pennsylvania and Allegheny County, these apps have not yet been rolled out. I do believe they're being considered, but what is being utilized right now is a different type of app that I wanted to end my portion of the conversation discussing. And this is called the Sarah Alert app. And this is an app, again, that is being used statewide and is being used within Allegheny County. And this does really nicely complement the ongoing case investigation and contact tracing efforts within the county. So basically what happens with this Sarah Alert app is that individuals who are identified as cases are isolated and at that time enrolled by the case investigator into the Sarah Alert system. And this Sarah Alert system allows cases to then report their symptoms over time, and their symptom resolution can be tracked, and their isolation or release from isolation can be tracked and automated. And this really helps because otherwise, again, the manpower that you would need to not only do the initial case investigation, but also to follow through for release from isolation would be exceptionally large. So this really helps to make this process more efficient and automated. And then similarly, the contact tracers also have the ability when they place an individual in quarantine to enroll them in this Sarah Alert app. And these individuals in quarantine also report their symptoms or lack thereof over time. And any of this reporting can be done in a number of ways. A number of platforms can be used, internet, email, phone, or an app. And the data then is shared and tracked over time. And the individuals that don't develop any signs and symptoms then can be released from quarantine. And if they develop signs and symptoms, then they can be more rapidly identified as a case in which they can be isolated. So again, this really helps to speed up identification of new cases and isolation of those new cases. And so again, this app being used at both the county and statewide level. And I think this again highlights the collaboration interaction between county and state. And I thought this would be a good time to then turn over and pass the conversation to my colleague, Dr. Brand.
Okay, good afternoon. Like Dr. Haggerty, I am delighted to be here this afternoon. And I'm going to share with you some of the state level response to COVID-19. And let me just start by saying that all of the data and graphics in my presentation. Oh, sorry, forgot to start my video. My apologies. Oh, I can't get to it though. Hang on.
Wendy, you're good. We can see you now.
Oh, you can. Okay, great. Thank you, Jessie.
No worries.
Pardon my technological ineptness.
No, you're good.
Right. Let me restart by saying that all of the data and graphics in my presentation are from the Pennsylvania COVID-19 dashboard, which is on the Pennsylvania Department of Health's website, and the web link, excuse me, is displayed on this first slide only. So here we see the case counts and epidemiologic curve or progression of the disease at the state level as of yesterday, June 11. So let's recall the timeline with regard to the state. On March 6th, Governor Wolf reported Pennsylvania's first 2 confirmed COVID-19 cases in Delaware and Wayne counties. Both were travel related. One person had traveled within the US and the other to Europe. And then on March 18th, the Pennsylvania Department of Health, reported the state's first COVID-19 death, who was a patient at St. Luke's Fountain Hill campus in Northampton County. And so now here we are with over 75,000 confirmed cases and 6,000 deaths. Oops, now it doesn't want to advance. Uh-oh. I can't seem to make it advance, Jessie. I'm not sure what I'm doing wrong.
Wendy, I don't know if I can help you with that side. I can see your title slide now.
Oh yeah, I know, and it kind of went
If you
backwards.
use your arrows, maybe?
No, it's just making like this weird sound. Oh, my apologies.
That's
Let
all
me
right.
Let me stop sharing my screen for a minute and see if there's something that's, Can you hear that sound? I
cannot. Do you want to try sharing it again? In the
Sure.
meantime, I will just encourage people have been posting a couple questions in the Q&A, and if you continue doing so, I will moderate those and ask our speakers when we get to that portion.
Okay.
Wendy, is it working?
No, it's just making like this weird sort of horn sound, and I can't. Oh dear. All right.
It looks like it's not in focus. Can you click on the slide and then try to move forward?
Ah, there we go. Thank you, Mike. You fixed me. Okay.
He's our lifeguard. All right. We're back up and running. Thank you.
My sincere apologies, folks. Guess you didn't know it was going to be quite so exciting, huh? Okay, at any rate, here we are. Here are those 75,119 cases displayed at the county level per 100,000 population, with increasing numbers of cases being represented by the darker shade of red. And here is the breakdown of cases by gender, ethnicity, age, and race at the state level. excuse me, the Department of Health does collect additional demographic information on a variety of parameters, for example, about vulnerable populations such as people without permanent housing, for purposes of guiding the response and recovery efforts. And similarly, this is the breakdown of COVID-19 related deaths by gender, ethnicity, age, and race at the state level. There are 514 testing sites across the state. And as of last Friday, June 5th, there were 15,924 PCR test results reported to the Pennsylvania Department of Health. The Wolf administration has developed an enhanced testing strategy with a focus on 3 pillars. Ensuring a test is accessible for all Pennsylvanians with symptoms of COVID-19, availability by increasing supply and building community capacity, and adaptable to the evolving landscape of the virus and the data. The Department of Health has set a goal for 90% of people in Pennsylvania to live within 45 miles from a testing site, and for 2% of the population in every region throughout the Commonwealth to be tested per month. And that is, to be clear, diagnostic testing with PCR that determines that the virus is in fact in the blood. So that's the definitive test for determining that a person has COVID-19. Serologic testing, which tests for antibodies in the blood, is much less reliable, and yet it does provide good information about the number of people who have been exposed to the virus. And so the state is currently creating a policy and procedure around doing serologic testing in order to eventually determine prevalence of the virus in specific populations, such as congregate living communities like nursing homes, where testing will be done, at 100% level, and then ultimately trying to establish prevalence of the virus, across regions and ultimately across the state. But it's all, very much a work in progress. So currently, there are no FDA-approved drugs to treat COVID-19. But on May 1st, the U.S. Food and Drug Administration, or FDA, issued its first emergency use authorization for the antiviral drug Remdesivir for the treatment of confirmed or suspected cases in adults or children. The drug is administered intravenously, and it is a hospital-based antiviral. So on May 9th, the U.S. Department of Health and Human Services announced an allocation plan for Remdesivir that had been donated by Gilead Sciences Incorporated, the producer of the drug, for the treatment. It had been donated by Gilead to the U.S. for use in areas of the country most impacted by the pandemic. Pennsylvania was not among the states that got those first 2 announced shipments, but since then, Pennsylvania has gotten 3 allocations and has made 3 corresponding distributions of Remdesivir to hospitals across Pennsylvania, for a total of 18,066 doses to 210 facilities. And the hospitals that received these shipments were determined based on the number of COVID-19 patients at the hospital over a recent 7-day period, and the severity of the illness of those patients based on whether they're on a ventilator. And hospitals, the State Health Department has set up a reporting mechanism for the hospitals, and hospitals are required to report on their usage. But hospitals, while many hospitals are reporting, not all of them are apparently, and that's more due to just a slowness in reporting. It's not that they're not using the drug, you know, hoarding it, if you will, for you know, later times when they might get hit you know, harder again. The state, you know, will continue to make distributions as allotments continue to come from the U.S. Department of Health and Human Services. So Dr. Haggerty did a nice job of explaining the process of case investigation, contact tracing, and monitoring. The plan for Pennsylvania has 4 guiding principles when it comes to those processes. Currently, the Department of Health has about 150 staff for case investigation and contact tracing. So in the areas with county or municipal health departments, those entities really take the lead, as Kathy described with Allegheny County Health Department. Dr. Haggerty also touched upon the developing technologies that the state is using or intends to use to augment human efforts, including the MITRE SARA Alert web-based monitoring tool, and the Apple-Google collaboration that, as she explained, uses Bluetooth proximity exposure notification technology to ping opted-in individuals about geographic proximity to a person with COVID-19 positive status. Importantly, as she also mentioned, people have to opt in to make it work. And they have to opt in 2 ways. One, they need to download the app and agree to participate. And 2, COVID-19 positive people who have had COVID-19 have to reveal their status, because that's how people get notified that they are in close proximity to someone who is a potential exposure risk. And the health department estimates that you have to have 70 to 80% buy-in in a jurisdiction to really make the app viable. So it really remains to be seen in this country whether that technology will be successful, whether there'll be enough buy-in. Certainly in some other countries where there is a higher level of trust of government, for example, Taiwan, these web-based technologies and use of data that was voluntarily provided or given access to the government by citizens has really proven to be successful. So as the state reopens, there will be a need for additional testing and contact tracing. And Dr. Haggerty did touch on the state's plan to train volunteers to do contact tracing. And currently the health department has been and continues to develop partnerships with universities and local health leaders to increase that capacity. Harrisburg Area Community College is developing a contact tracing course, and their goal is to produce a core of credentialed contact tracers, and they see that as a potential job opportunity, which you know, it certainly may be, because certainly the need will continue and even increase as counties open up and we inevitably see more cases. There are also good online contact tracing courses from the Association of State and Territorial Health Officials, Johns Hopkins, Bloomberg School of Public Health, and even some of the HRSA-funded public health training centers. So there are certainly lots of opportunities for people to gain the basic skills to enable them to serve in that capacity. And the state is also working with universities, health systems, and commercial vendors to increase testing capacity. The testing, the state lab, you know, really has improved its efficiency and ability for test throughput, but they are constrained by their physical location, the amount of space they have, and the amount of personnel that they can accommodate. And so they are in the process of working with commercial vendors to contract to increase the capacity on behalf of capacity of testing on behalf of the state. And the hope is that with all of these partnerships with communities, with commercial entities, with increased funding from various sources in the federal government, with potential donations, the Department of Community and Economic Development is actively pursuing potential donation opportunities through foundations and interested corporate entities. And so the hope is that with all these partnerships and increased resources, the Department of Health will be able to focus more resources on vulnerable populations. Currently, of course, the department has special sort of strike forces who can go into congregate settings where there have been outbreaks to do some education and testing, and also to work with facilities on control of infection control and in order to avoid outbreaks. And as far as reaching the 2%, as far as their testing goals, they are in the process right now of coming up with a plan for reaching specific hard to reach populations to make sure that they are included in those, in the testing efforts. So as we all know, there's a red, yellow, green phased reopening process. This is last Friday's map. Counties moving from one stage to the next are announced by the governor's office on Friday, and then each Friday, and then their status changes the following week. And within this framework, the Wolf administration, as I'm sure you are familiar, laid out broad criteria for progressing from red to green. The initial target was fewer than 50 new confirmed cases per 100,000 population over the previous 14 days. But then there were also other less quantifiable targets, such as having enough testing available for symptomatic individuals, high-risk populations, healthcare workers and first responders, having established a substantial contact tracing and case investigation process, and identifying all of that area's high-risk settings, including prisons, personal care homes, skilled nursing facilities, and other congregate care settings, and ensuring that such facilities have adequate safeguards in place. In terms of specific metrics, the Department of Health uses a risk-based decision support tool developed by Carnegie Mellon University that tracks 4 specific metrics. So if you click on the county on the reopening map, you'll see the 4 specific metrics and the county's status. And so here you can you see this big, you can see just the little corner of, bottom corner of Allegheny County lit up there. And this black box comes up, and then when you click on county dashboard, these 4 specific metrics come up, excuse me. The Department of Health uses these metrics and makes recommendations to the governor's office, but ultimately it's his call. As we know, public health is inherently political, and while we public health experts always lead with the data, and in fact, the state health department has been doing a great job of that, you know, at the end of the day, there are other factors certainly that are included in the ultimate decision-making process. So I think I'll stop there, and I look forward to our discussion.
Oop, Kathy, you're muted. There's some tech challenges.
It's just a comedy of errors today.
All right, I'm ready to kick off the conversation, Jesse, if that would,
yeah, that would be great. I think I'm going to actually, if it's all right, I'm going to jump in because there seem to be a couple questions from participants, and they are around some common themes. And so I guess I will start with a question about resources for contact tracing at the state level and then at the county level too. Sort of one question is specific to how many contact tracers are currently on staff or working at the Allegheny County Health Department. And then another question was related to something that you, Wendy, talked about was what about counties that don't have a health department in them? So maybe we could start, Wendy, with you, if you could talk about at the state level a little bit, and then Kathy, if you could get into some of the specifics about how many and who are they, that would be great at the county level.
Sure. So the state has currently about 150 on staff contact tracers, and they are they're public health nurses, they are disease intervention specialists, they are epidemiologists, they are other folks from other parts of the health department that have been whose jobs have been repurposed for this effort, and in the large amount of money that the state, as all states, got from the Centers for Disease Control and Prevention, a portion of that is dedicated to hiring more contact tracers. So in addition to the efforts to develop a volunteer corps, the state will in fact be investing in additional contact tracers. Now, as far as the counties that do not have a health department, which are the majority of counties in the state is broken into 8 regions. And so and each region has a regional public health presence of sorts. That may be a small office with 1 nurse in it, literally, in certain regions. And yet, you know, clearly with the pandemic, there was just a need to marshal forces, you know, in those areas. And so, in particular, in the northwest parts of the state, the state health department has sent staff there to do the contact tracing and the management of the process in those parts of the state. and elsewhere in the state where there is not a county or municipal health department, or frankly where municipal health departments, which tend to be smaller and have fewer resources than the counties, quickly become overwhelmed, and then in that case the state also steps in to assist there.
Great, thanks. Kathy, for the health for Allegheny County in particular, can you talk a little bit more?
Sure, I'll talk a little bit. So I would say when we were at sort of the highest number of cases per day in Allegheny County, that there were probably around 35 to 40 case investigators, and then to each case investigator, there were about 2 contact tracers per investigator. So I think that just kind of gives you a sense of sort of the size of the overall team. And that was certainly a bump up. I mean, I came on board to add to that case investigation team. Medical students came on board. There's also a restructuring within the health department itself to support that temporarily. I know that now there are a few more full-time individuals coming on to fill those case investigator roles because there are standing staff positions for this, but as you can imagine, the need for that is greater at this time. Yeah, so I think that kind of gives you just a general sense. I don't think I have anything else really to add there. So it's but again, I think the intent is to bring on to have a larger core team, and then to have that flexibility to take advantage of this medical reserve corps. And these other contact tracing consortium as needed.
So I just want to point out that Dr. Newman, the chair of our Department of Epi, put in the Q&A a good note that our school and the department is offering a 1-credit course on COVID-19 containment as part of an applied Epi special studies course this summer. And so I think there may be 1 or 2 remaining slots open. I think it's pretty popular, but our hope is that we'll see some good turnout there, and then it might be available in the future. And just a little bit of a plug for the school and the efforts that are happening here. So I know there are a number of questions. I promise everyone that we will get answers to these questions. If we don't get to them right now during the discussion, I will ask our speakers to do a little bit more work and to write up responses, and we'll post them on the website. So let's get back to a few of the specifics here. One that really stood out to me, because we have not talked about it yet, and so I'm gonna give it to you and see what happens. What does the Department of Health, how do they handle enforcement of mask compliance and other guidelines in retail establishments? And the poster here notes that they see the guidelines consistently ignored, especially since we moved into the green phase. And that was a question that I also had for you too, sort of, what does the green phase mean? And it feels like there's a lot of misunderstanding. So let's start, Kathy, if you want to talk a little bit about mask compliance, that would be great.
Yeah, absolutely. So yeah, the question of enforcing mask compliance, I think this is one that comes up. It was actually something that I pulled together for frequently asked questions page for people who are answering calls incoming to the county health departments. I think it's definitely a concern that's shared by others in the community as well. And so essentially, I guess the answer to the question is that it is the responsibility of the business to enforce the use of face coverings. And so a complaint could be made against a business. And there is a there's a website for making coronavirus complaints in the state actually available, and it could cover anything from issues like this of non-compliance, other concerns that you might have related to business conduct of, business that shouldn't be open and things like that. So it's a general way to share that information at the state level. But the short answer is that at the end of the day, it's the responsibility of the retail establishment. It's a challenging one, that's for sure.
So that this is a great concern for the state health department. I mean, we all see when we're out and about, that people are not being compliant with the mask wearing, in closed settings and grocery stores, and other potentially problematic places. The state's approach has been to send warning letters to establishments that are non-compliant, for various reasons, they don't have their adequate social distancing measures in place, or they're clearly not enforcing the mask wearing policy. There's a concern that people are becoming complacent and sort of getting tone deaf to those messages. And so I think that the approach is really going to be to become more targeted. And it's a joint approach between the health department and the Department of Agriculture, because ag is the department that deals with restaurants, with food establishments. And so I think that the approach is really going to be more to hone in on kind of the perpetual bad actors, the entities that just are continually non-compliant, and then also large-scale events that have the potential for broad exposure.
That's very helpful. Thank you. So I fear we're getting close to the end of our time. I wanted to give each of our speakers maybe a minute to any final comments or reflections. I appreciate you both addressing what is a really complicated issue. We'll start with you, Dr. Haggerty. Is there anything that you want to add to what we just discussed?
Yeah, I think just to close that, I'm glad we're having these discussions about the need to build up public health resources to respond to COVID-19 and to prepare us so that we are more adequately prepared in the future to respond to outbreaks. So I think this is a good opportunity for us to reflect and think about what we're doing well and what we need to do moving forward.
Great, thank you. And Dr. Braun?
So as a former state health official, I have just been fascinated to watch the variability in how how different states have approached this, how the governors have approached it, and the how the health department has approached it, and the amount of influence the commissioner of health and health department have in terms of the governor's decision making, and I think. And we see, that the outcomes of that, right, in the cases and the recent increases in cases that, open up despite indications that they shouldn't be. And I just think that Pennsylvania, in watching Pennsylvania's response, Pennsylvania has done a really good job. I think the governor has paid close attention to the guidance, the evidence-based guidance that the health department, has been giving him. And while the response in Pennsylvania has not been perfect, they really just have made tremendous advances in terms of the coverage of testing and contact tracing and the containment of cases and the ability to reopen the state in a safe manner.
Great. I appreciate you both taking the time, and thank you to everybody for participating in today's COVID-19 conversation. Again, I promise you that we will get responses to the questions that didn't get addressed, and they will be posted online as soon as I can track down the speakers and get them to spend a little extra time with us. So I hope that you come back next Friday and join us at 4. Patricia Docume will join us with 2 of her community partners to talk about the effects of the pandemic on Latinos and immigrants. And then I'm really excited to share our plans for the last seminar in this series. So that will happen 2 weeks from now, where we'll discuss COVID-19 and the future of public health. And so we touched a little bit on it right now in the closing, but what does this mean for public health moving forward. And so Dr. Peter Salk will join us. He is part-time faculty in infectious disease and microbiology and president of the Jonas Salk Legacy Foundation. And then Dr. Mehran Massoudi, who is currently a captain in the US Public Health Service, will join us. He's also a distinguished public health alumni. And I noticed that he posted a question that we didn't get to today. So I'm so sorry about that, but I promise we'll get an answer. He will join us and have a conversation again about how does the public health, his experience in public health practice, and reflect on what we can do to extend the reach of the field of public health and improving population health and well-being. So I'm really excited to wrap this series up with the two of them. So again, thank you so much for joining. Thank you to everyone, and I hope to see you next Friday. Thank you. Bye.
Bye.